Hello, I am Elizabeth Swanson. I am a general surgery resident at Oregon Health and Science University. Today, I will be presenting our research on the impact of critical care management of brain-dead organ donors on donor heart utilization and cardiac graft survival. Current risk-adjusted models used to predict donor heart utilization and cardiac graft survival from brain-dead organ donors do not include donor critical care data. Thus, I sought to identify novel independent predictors of donor heart utilization and cardiac graft survival. We obtained data from the DMG web portal for 4,423 organ donors managed from 2008 to 2013 by 10 organ procurement organizations. After excluding pediatric donors, donors after circulatory death, and donors enrolled in a clinical trial, 3,433 donors were included in our study. 1,134 hearts were transplanted from these donors, and 969 cardiac grafts survived after a mean of 684 days of follow-up. We analyzed donor critical care data from 3 standardized time points during donor management: authorization for donation, organ allocation, and at the end of donor management just prior to organ recovery. If a donor critical care variable was statistically associated with our outcome variables at multiple time points on univariate analysis, then we preferentially use the data from organ allocation in our multivariable models, as this time point is when organs are selected for transplant. We identified achieving 7 or more donor management goals, ejection fraction greater than or equal to 50%, and P to F ratio greater than or equal to 300 as independent positive predictors of donor heart utilization. In addition, we identified serum creatinine, administration of epinephrine, and administration of thyroid hormone as independent negative predictors of donor heart utilization. After inclusion of the variables from the SRTR risk adjustment model for first-year cardiac graft survival in the multivariable analysis, administration of higher doses of thyroid hormone during donor management was the only variable independently associated with cardiac graft survival. In conclusion, administration of thyroid hormone has discordant effects on donor heart utilization and cardiac graft survival, and thus warrants additional study. I would like to thank our funders, as well as my mentors at Oregon Health and Science University. Please feel free to contact me with any questions about our research.